So I'd like to start by thanking the BC Patient Safety and Quality Council to give me the opportunity to share my perspective and my hopes for the healthcare system. Perspectives are in the eye of the beholder and are relative. And I just want to make sure that these are my perspectives and don't necessarily reflect the ones of my employer. I will try to give you 18 elements of my views because there are only 20 slides, and these are snippets. They're really thought-provokers and hopefully will trigger some reflection. I'm not an expert, but the fact that I'm standing in front of you tonight means that I'm not afraid to be opinionated nonetheless. So let's agree. Our healthcare system is not a healthcare system, it's really a sick care system. We are very good at preventing people from dying, but our system is not as well equipped to make sure that we live in a healthy body with a healthy mind and that we age and live well. Let's be honest. Our system is not that great as we make it look like. The Canadian healthcare system comes second to last in the Commonwealth Fund assessment of 11 Western healthcare systems. The US is the only one that's considered worse. So we are obviously not the racehorse, but we're the donkey in this race. And we also should stop to gleefully compare ourselves nationally with other provinces when we exceed some health parameters in comparison. These comparisons serve only one purpose, it's to provide political cover for underperformance. So in a receding stride, boats get stuck. Let's stop and not pretend that we are a single-payer system. Substantial parts are, but not prevention, dental care, drugs, therapies, and certainly not mental care and elder care. Let's acknowledge there are many for-profit elements in what we see as a not-for-profit system. Many physicians, pharmacies, dentists, therapists are part of for-profit entities. And this doesn't have to be a bad thing if we use this intelligently. Let's agree, this system needs fresh resources. Existing deficiencies, chronic disease growth, aging population, other factors all add to the cost. And we have to consider other funding sources than government revenues and taxes. We need to assess performance openly. Parameters like access, equity, cost, disease prevalence, recidivism need to be tracked. We have to look at these trends, and we have to develop strategies and plans to do an honest assessment, which is the condition for improvement. We also have to recognize that the system is universal by name, but not really by fact. As mentioned earlier, prevention, mental health, dental care, and drugs, etc., are all not part of our so-called universal system. We have to accept that and then discuss how we can provide for these additional elements that make it ultimately universal. We need an authentic funding discussion. We can't just dismiss the public-private mix opportunity as un-Canadian. It doesn't mean if we only have private funds flowing that we're emulating the US. Mixed systems across the world exist. None is perfect, but they're certainly better. We need to invest in prevention, annual checks, screening, nutrition advice, exercise incentives, health education are important investments that will increase the quality of life and reduce cost in the long term. To do so, we need more healthcare professionals. And we have to educate them here, not poach them from abroad. The ones that immigrate, we should credentialize very quickly and effectively. We have to use their talents as quickly as possible so they can help us care for our population. We also have to change the business model of primary care. We have to provide systems and support to our physicians, nurses, therapists to do what they're trained to do and not to run a business. They could work in integrated care entities that are managed by professional managers. We have to embrace innovation. The benefits of innovation should be internalized where the innovation risk is being taken. We have to break down these silos, these budget silos, and the decoupled system components to give innovation a chance. because we need to adopt scientific progress and new technologies like genomics and artificial intelligence. We have to foster the system's ability to adapt and adopt new solutions. Somewhere, somebody has found a solution. If you want to apply artificial intelligence, it requires intelligence in the first place. We have to implement digital health records. Patient data, our own data, clinical data, genomic data, has to travel with us. And then we have to have the power as individuals to share that data for research and system improvement opportunities. Sharing data today saves lives tomorrow. We have to accept that the illicit drug use health crisis is a health crisis. And we have to support the systems that allow people to get off drugs and return to a healthy and productive life. We have to stop the overdose crisis. If Portugal can do it, we should certainly be able to do it as well. And we have to care for our elderly. The system is disrespectful and it's not sustainable. We could learn from our indigenous people how to respect the elders. Other models have been used, tried, and tested. How about widely available home care? Finally, one day, I'll enjoy the level of healthcare these two members of my family get. There is prevention, ample exercise, healthy nutrition, and very timely access to care. And I have to say, that day, I'll be as happy as they are. Thank you very much.